All right, everyone. Thanks so much for joining tonight. My name is Sydney Klum, and I've been involved with EFCO for a few years now. I had benign Rolandic epilepsy when I was younger, but I outgrew it. And then my brother was diagnosed with epilepsy a few years ago. So my family and I have started becoming connected with EFCO since then. We're just going to start out tonight by thanking our sponsors. This year, our Epilepsy Connect Symposium is presented by AZI, and we want to thank our daily sponsor, Greenwich Biosciences, for supporting our sessions on this Friday. We're going to hold all the questions until the end, but feel free to enter them into the Q&A box at the bottom during the presentation, and we'll get to those at about 10 minutes or so before the end. I'd now like to introduce Dr. Collier. A little bit about her. She earned her medical degree at the University of Texas Health Science Center at San Antonio. She then completed an internship, residency, and a fellowship in clinical neurophysiology with a focus on epilepsy at the University of Utah. Dr. Collier completed an interprofessional fellowship in integrative medicine with the Academy of Integrative Health and Medicine. Dr. Collier has been the medical director of the epilepsy program at St. Mary's Hospital and Medical Group in Grand Junction since 2016. Her center has been designated since the inception of it as a certified level 3 epilepsy center by the National Association of Epilepsy Centers, one of the few rural level 3 comprehensive epilepsy programs of its kind. She's also a member and/or fellow of the American Academy of Neurology, American Epilepsy Society, American Clinical Neurophysiology Society, American College of Nutrition, and the Academy of Integrative Health and Medicine. So without further ado, I'll go ahead and let Dr. Collier jump on and start her presentation.
Well, my name is Dr. Marie Collier. I am an epileptologist in Grand Junction, Colorado, and I am absolutely excited and incredibly honored to be here and to have an opportunity to present the 8 dimensions of the wellness wheel. I would like to extend my deep gratitude to ASI as well as Greenwich for their dedication to research and providing options for our patients with epilepsy. As Sydney had mentioned, I am an epileptologist. I am board certified in epilepsy as well as neurology. I also am fellowship trained in integrative medicine. And so I consider myself an integrative neurologist and an epileptologist. And the reason why that is important is because one of the things that I noticed when I was a fellow in epilepsy was that we would frequently give patients their medication and be like, okay, there you go, here's your medications, just take them and good luck. And yet when I was in my internal medicine intern year, patients with cardiac disease were getting education on diet and lifestyle. Patients with diabetes were getting education on diet and lifestyle. People with hyperlipidemia were getting education on diet and lifestyle. And I just didn't think that that was right, that, you know, epilepsy was different than any other disease in that diet and lifestyle could not play a contributing factor. And any person with epilepsy or any family member of a person with epilepsy knows for sure that there are certain factors that can in fact lower seizure threshold. And anti-epileptic medication does not modify the disease in any way, meaning it doesn't affect the ultimate outcome of the disease. All it's really doing is working to raise the seizure threshold. So really and truly what I look at the wellness aspects of epilepsy, I look at it as a way to make the medications more effective and to give patients with epilepsy a better chance at success. So also it's particularly special to have the Epilepsy Connect Symposium this month. You know, living in Colorado, before I was here, I was in Montana. I was there for a couple of years practicing it as an epileptologist, and we did not have an epilepsy advocacy group such as the Epilepsy Foundation. in Montana, and you could feel it, or at least I certainly could, and the patient certainly could, because you did not have an advocacy group, you did not have a way to connect. And so being in Colorado now for 4 years has been absolutely tremendous. It has been an incredible honor and an opportunity to be on the professional advisory board for the Epilepsy Foundation of Colorado. The resources, I'm always learning something from the Epilepsy Foundation website. This month in particular is National Epilepsy Awareness Month. I always find it interesting that it comes on the heels of Breast Cancer Awareness Month, when more patients are dying annually from epilepsy-related causes in America than breast cancer, and yet you see pink ribbons everywhere in October, and yet you don't see the volume of purple ribbons in November. And so I think that is changing. The paradigm is certainly changing, and it is due to organizations such as the Epilepsy Foundation. And having the Epilepsy Connect Symposium in November is a particularly special time to have a meeting like this. So every one of these slides, and I will make these slides available to Wendy, and hopefully there would be a way for her to have it as a PDF and make it available to anyone who asks for it, because at the bottom of each of these screens, there is going to be a link, a website that you can go to and get this information. So several years ago, I think 2016 or so, the Epilepsy Foundation created the Wellness Institute. And I remember dedicating my entire time at one of the American Epilepsy Society meetings to going around and trying to specifically find the person in the Epilepsy Foundation who created this Wellness Institute, so that I could hug them back in the old days when we could hug people. Remember that? And it's just such a tremendous resource. You go onto the Wellness Institute website, and every one of these wheels has a link with other links in it. And I'm going to kind of touch on each one of those, how they impact patients with epilepsy and their caregivers. This doesn't just apply to patients with epilepsy. I kind of think of myself as a preventative epileptologist, much like people in stroke are, preventative vascular neurologists, much like there can be preventative cardiologists. So for people who've already had a seizure, I like to figure out ways to try and prevent them from having another seizure. For people who've never had a seizure, I like to think of ways to maybe keep it so that you never have a seizure. You know, if you have a brain, you can have a seizure. We all have a seizure threshold. Those people who are born with epilepsy, they have a very, very low seizure threshold. Those who've had a severe traumatic brain injury have, basically acquired epilepsy. And then for various reasons, I'm an adult epileptologist, and for various reasons, adults throughout the years can develop epilepsy. And in fact, after the age of 60, you have a 3% per decade chance of developing epilepsy as you age. And so, this is one of those things, I stay humble, and I also stay open, and I keep in mind that we all benefit from wellness. And so the Wellness Institute focuses on 8 dimensions of wellness. That's diet, nutrition, emotional health, independent living, physical activity, education and employment, social relationships, sleep, and stress management. And basically it's factors that contribute to the overall health and well-being of someone living with epilepsy, as well as their family, friends, and caregivers. So it was, as I mentioned, it was founded in 2016 to promote a holistic approach for health for people living with epilepsy. So over here on the right, if you look at this kind of screenshot, when you go on to the 8 dimensions of the wellness wheel, each one of these, this emotional health, stress management, sleep, diet, nutrition, each one of these, you can click on it. And what we're going to do as we go through my slides is I'm going to kind of show you what it would look like if you clicked on each one of these and some of the information there. And again, it is tremendous. There's a wellness and epilepsy toolkit PDF here that's an absolutely beautiful little booklet with information on wellness. I have a dream that possibly, and I'm just planting seeds, Wendy's, if you're listening, that there would be like an 8 dimensions of wellness workbook, and like providers and support groups could have this workbook that they could meet and actually go through the workbook together, virtually, of course, right now, but each week addressing one of the aspects of the wellness wheel, and having like, I don't know, even having something in there, but I think an 8 dimensions of wellness workbook is needed. So the wellness initiative is needed in the epilepsy community. Adults with active epilepsy are more likely to have unhealthy behaviors, other chronic health problems, and report poor health. And, you know, unhealthy behaviors can be cigarette smoking, sedentary lifestyle, being less active. Sleep is a huge issue for everyone, as far as I can tell, but certainly for people with epilepsy, it can lower seizure threshold. They can have other chronic health problems. Here's the bad news. People with epilepsy don't, quote unquote, just get epilepsy. They get other, when I say just, I don't mean to disparage that, saying just in any way. I'm saying that they don't just get epilepsy, and that's not the only disease that you're going to get. You're also going to get all of the other health problems that come from, you know, a poor lifestyle choices. So it's very important, because as you develop other chronic health problems, epilepsy can get worse, and it can affect morbidity, mortality, quality of life, cognition, ability to work, those types of things. And also seizures have an impact on how many healthy days can be reported. You've had 1 or more seizures in the past 3 months, patients with epilepsy are more likely to report unhealthy days. So children with epilepsy have more problems with self-care, movement, using their hands, so dexterity, learning, communication, and behavior. So, and that is an imperative time to, you know, your formative years in childhood. That's when you're setting up your foundation. So it's incredibly important to think about wellness for children as well. So getting or keeping a healthy is part of a seizure, self-management, and taking care, starting to learn about diet, nutrition, exercise, stress, sleep, emotional health, and more can actually set you up for a foundation for success. So this is the epilepsy toolkit, the PDF. It's a 39-page color-rich document. And again, I have a link down at the bottom in the corner there. And the link is also available on the Epilepsy Foundation Wellness Institute website. So what is wellness? You hear it's like a buzzword. You know, you'll see it at Walgreens, Rite Aid, when Rite Aid used to be open. You know, you're kind of like, what is this? So I love this definition from the World Health Organization, because wellness is a state of complete physical, mental, and social well-being. It is not merely the absence of disease or infirmity. So it's more than just, you know, you're not sick. There's something more to it. The components of the wellness wheel do comprise what wellness really is. So again, wellness refers to a healthy balance of mind, body, and feelings. It is also an approach that focuses on a person's health and how to prevent and manage medical problems. The emphasis on health and well-being rather than a specific disease. The term wellness may describe a person's overall health, happiness, and comfort. Reaching a state of wellness is ideally self-directed and community supported, a conscious and active process, and making choices that lead toward a healthy and fulfilling life. So this is a 284-page document from the Institute of Medicine, IOM, that came out, I believe, in 2012. And I remember when I first thought about this as a resident and a fellow, because it was actually sponsored also by the American Epilepsy Society, and those two links there are access points to it. You can get it from the American Epilepsy Society website, as well as the book's website there from the NCDI. But basically, it is a document talking about how epilepsy is a spectrum disorder. And that really hit home to me. You know, you do see this spectrum of epilepsy. It's not just one disease, and seizures are a symptom. And to me, that really, I remember when I first heard that, I had to process it because I had never really thought about it, but now it's second nature. So basically, in an Epilepsy Foundation community survey, and on their website, they have a link to the survey, participants ranked improving quality of life as a top area that epilepsy researchers should tackle. Studies show that social and emotional support and overall sense of well-being have more impact on quality of life than seizures themselves. And I can tell you as a clinician, very, very frequently, I see this every day. Seizures for a lot of my patients with epilepsy are actually the least of the problems that people are having. There's so much more that goes into life than just seizure freedom. I can make anyone 100% seizure free, but it's a matter of, whether or not you can actually function because you're on so many medications, or you're completely gorked and you can't move. That's not a quality of life. So it's really walking that balance between quality of life and seizure freedom, and then all of the other aspects that go into wellness and well-being. So here's a clip from the survey, the community survey that is linked on the Epilepsy Foundation website. And again, every day I am blown away by just the richness and the resources that are available through the Epilepsy Foundation website. I'm always learning something. There's videos, there's chats, I'm seriously humbled and blown away by how strong of an organization this is. But I love this graph because what it shows here, whether it's daily, weekly seizures, monthly seizures, or yearly / over a year. So it's purple, yellow, and turquoise. The biggest concerns across the board for patients who were asked to rank what researchers should focus on, stopping seizures and improving quality of life, were the top choices. So a well-rounded approach to wellness empowers individuals to take an active and engaged role in their healthcare, which is important for self-management and improving epilepsy and wellness outcomes. So essentially the Wellness Institute, and this is a screenshot from the Wellness Institute with the link down there below it on why wellness matters, brings together people with epilepsy and key stakeholders regarding epilepsy and wellness. This is a mission statement, and it's so dense and rich and just commendable. So it raises awareness and educates people with epilepsy, professionals, and the public, enhances network communication by providing support and for implementing wellness activities, implements programs that enhance all 8 wellness dimensions, identifies professional and community resources at the national and local level, inspires a culture of wellness by encouraging proven healthy lifestyle behaviors throughout the foundation, promotes and disseminates research and innovative therapies, trains and educates caregivers and epilepsy professionals, advocates for those with epilepsy, and forms partnerships and collaborations to expand our reach. Whoa, to me, that is like, wow, what a mission statement. That's why I wanted to read each one of those, because I know y'all could read those yourself, but I feel like that is such a deep and profound and honorable and noble mission of the Wellness Institute, and I certainly hope to keep that momentum going. So here it is again, the beautiful wellness wheel. I actually have this printed out in my exam rooms. And number one, it's pretty. And number two, it really does say so much. So let's start with emotional health and what that is. And emotional wellness involves being aware of your feelings, mood, and behavior. It means being able to accept feelings and being aware of changes. It means also finding ways to enjoy life despite your challenges. Emotional wellness is important for all of us, not just people with epilepsy, but family members, caregivers, and friends. Mood disorders, depression, and anxiety can have a direct impact on our emotional health, and these problems can also affect how we feel physically. They affect other health problems too. So this is what you would find if you were to click on the link for the emotional health on the Wellness Institute page. There's this absolutely beautiful video where they actually interview people with epilepsy and talk about what emotional health means to them. And it's a very, very moving video to watch. And then as you can see, within emotional health, there's all kinds of other links embedded in here. It's absolutely amazing. And I can't recommend it highly enough. So the biopsychosocial model of epilepsy, a long-standing focus on seizure freedom, adequate psychosocial assessment is imperative. Depression remains a major comorbid psychiatric syndrome with epilepsy. Stress and anxiety can be seizure triggers. My patients tell me that all the time, and lived experience needs to be incorporated into understanding quality of life. And this is a book here called The Body Keeps a Score by Bessel van der Kolk. And I find it very interesting. A lot of my patients with epilepsy do have a history of psychological trauma. Some patients have, we had a whole discussion on non-epileptic seizures by Dr. Strom. It's a very good book. I can't recommend it highly enough. He does trauma-informed yoga. So it's something to really think about, the biopsychosocial model of epilepsy and the role it plays in emotional health. So for people with epilepsy, mood disorders can happen more often than in people without epilepsy. Recognizing symptoms of depression or anxiety may be complicated. And interestingly, it's a bidirectional relationship, and I'll go into that a little bit more in a moment. But side effects of medications can complicate the clinical picture as well. Treating changes in your moods also means to consider treatment for your epilepsy. There are many ways to improve emotional health and some of those techniques, and we'll take a deep dive into some of these later. The Epilepsy Foundation does also provide some resources as well, but there's meditation, journaling, art therapy. Cognitive behavioral therapy is outstanding, and it helps people understand and manage their feelings. And I'll talk a little bit more about what CBT is in a moment as well. So up to 60% of persons with epilepsy, PWE, suffer from depression. So it's bidirectional. I call it deprelepsy. So if you have depression, you have a 30% increased risk of developing epilepsy. And if you have epilepsy, you have a 60% chance of developing depression. And so it's very important to address it. The term is called psychiatric comorbidities in medicine. And Dennis Spencer, who is a neurosurgeon at Yale, presented at the American Epilepsy Society a couple of years ago, and I just wanted to stand up and share. And he said, it's time that we stopped looking at the quote-unquote psychiatric comorbidities of epilepsy as comorbidities. They're part of the disease process, and I could not agree more. So I put this picture here because we are told to put our own oxygen mask on first when we are getting on a plane, and yet we never do that metaphorically in life. We're always giving, 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 and taking care of others. And so particularly for loved ones and caregivers who are taking care of patients with epilepsy, your emotional health is important too. You are not going to do your loved one with epilepsy any favors unless you're also taking care of yourself. So unhealthy caregivers cannot give their best care to their loved ones. So just keep that in mind, okay? So what you can do, building a social network, being on this talk tonight is a positive part of your emotional health. Being a part of a community, engaging in enjoyable activities, exercising, having a healthy diet, reducing stress, which is easier said than done for all of us. It's like if what you were able to go 1, 2, 3, don't be stressed, right? But practice new thinking strategies, kind of listen to your internal dialogue. And then there's the Managing Epilepsy Well Network, and there's a link there. So this is more information on what the Managing Epilepsy Well Network is. And then again, this is another link that is embedded in the Epilepsy Foundation's website, where it talks about self-management programs. Basically, other disease processes such as diabetes have shown much better outcomes with self-management tools. And so again, it was very frustrating because in epilepsy, the paradigm wasn't to offer patients things like self-management tools, talking about diet, lifestyle, stress reduction, all those types of things that can help. And so the paradigm is really shifting, and the Epilepsy Foundation has truly spearheaded that. So again, this is a screenshot from the Self-Management Tools website. The link is down there at the bottom. I think it's incredibly important. I have a ton of slides to go through, so I just want you to see this. I'm not going to read this whole page. I just took a screenshot of it so you could know where it is, what it looks like, and how important it is, and that there are resources for self-management tools within the Epilepsy Foundation website. So optimize seizure control by promoting adaptive behaviors. Up to 60% of patients with epilepsy do not take their medications as prescribed. So that's very important to remember, and that is based on clinical data. We're all human, and it's hard to remember to take your medications twice a day, every day. And studies show that the more times you have to take a medication during the day, so if you have a 4-time-a-day dosing medication, which most anti-epileptics are not for that reason, the more times a day you have to take your medication, the more opportunities you have to miss your medication. So it's not a judgment. It's not anything like that. Heavens knows that epilepsy beats people enough up. And so you don't have to beat yourself up more by getting mad at yourself if you've missed your medications. It's just kind of the nature of the disease, and it's the nature of being human. But it is also true, and that's why I recommend using apps with alarms to remind you to take your medication. Self-management tools can be a big part of that as well. So controlling seizures can reduce psychosocial stressors significantly, and thereby improving quality of life. And as I said, it's effective for other types of chronic disease. Biofeedback, you can use this as a self-management tool. It is basically a safe, non-drug treatment option for patients with epilepsy. They can go in, they can learn to control their bodily, involuntary bodily processes, muscle tension, blood pressure, heart rate, and it utilizes deep breathing, progressive muscle relaxation. Dr. Fry used to offer this through the University of Colorado, Denver. I'm not sure if she still does, but she's presented some amazing talks on this at the American Epilepsy Society conference, and it's a very, very valuable self-regulation skill for people with epilepsy, as well as all of us in general. There's also the relaxation response. It was pioneered by a cardiologist at a little-known university back east called Harvard. And he started studying patients in the transcendental movement. He actually almost got kicked out of Harvard while studying this. And it's the opposite of fight or flight. And he shows by using the relaxation response, you can reduce stress. And he showed in a paper that 60 to 80% of visits to primary care are related to stress. And yet less than 3% of patients actually leave with something to do about it. So it exacerbates a number of conditions, including hypertension, headaches, insomnia. And so insomnia, of course, can be a seizure trigger. I can't tell you how many patients have seizures when they lose sleep. And then over here on the right, that's a picture of the vagus nerve, cranial nerve 10. So it is what we actually have a vagus nerve stimulator, but this vagus nerve, this vagal response is something that you can tap into endogenously without having to have a device put in you. I'm not saying it replaces the VNS, but I am saying for those of us who don't have a vagal nerve stimulator device in us, we still have the capability of stimulating our own vagus nerve. It's called Get Vagal. I had a professor when I was in medical school. He was a pharmacology professor, and he had like 268 medical students in an auditorium going crazy. And he was from Odessa, Texas, and he would say, "Get Vagal, y'all." And so I still hear that to this day. Oh, I'm sorry, this thing is going to keep coming up. All right, here we go. This is cognitive behavioral therapy and mindfulness-based stress reduction. MBSR was pioneered by John Kabat-Zinn. He has an amazing book called Full Catastrophe Living. And he had done this in the 1970s at the University of Massachusetts. And basically, it does not change the disease. We can't change the disease for especially patients with neurologic disorders. That's kind of one of the challenges of being a neurologist as well as an epileptologist. It does not change the disease, but it changes how people deal with and approach and the relationship that people have with the disease. So it leads to improvements in anxiety, depression, and quality of life, particularly in patients with epilepsy. So there's some resources there. That little picture down there in the corner is me walking my dog after work. That's me on the left with everything in my mind, and that's my dog. And I often marvel, I'm like, what is my dog thinking about, you know? And then of course, yes, once again, the Epilepsy Foundation comes through. Look at this beautiful website. It's amazing. So this is a screenshot. There's the link right there, stress, wellness, mindfulness, and epilepsy. And so once again, you have some resources available through the Epilepsy Foundation. I'm not even kidding. It blows my mind how amazing their resources are here. And they're good for all of us, but basically just talking about the role that mindfulness plays in epilepsy, and it's an effective technique for combating stress, which can be a seizure trigger for a lot of my patients. Also, this is phenomenal. This is something that the Epilepsy Foundation of Colorado offers. I'm not sure when the next one will be, but I know that it does come up, and it's done via telephone and video, so patients with epilepsy don't have to travel anywhere, but it's Project Uplift. So it's using mindfulness and positive thinking to cope with negative moods associated with epilepsy. So Uplift is using practice and learning to increase favorable thoughts. So it's an internet and telephone-based program using cognitive behavioral therapy and mindfulness to address depression in patients with epilepsy. So there's, again, some more information on emotional health. So I'm gonna, given that I've got a lot to go through, I'm not gonna read the slides per se, but I am gonna talk about what stress is. There's a great book by Robert Sapolsky called Why Don't Zebras Get Ulcers? He's a professor at Stanford, and he's a behavioral researcher. He's written some amazing books. on studying stress. He originally studied it in baboon populations, where he wrote a book called The Primate's Memoir, which is an absolutely delightful book talking about his experience studying baboon colonies in Africa, and basically what he learned about stress, the role that it plays in health, those types of things. So basically, stress can be good, stress can be bad, but it's your body's response to change. And I can tell you for most of my patients, most importantly, too much stress can be a seizure trigger. So again, here's a screenshot. If you were to click on stress management and what that would look like, and then the resources that are available in there. And then, I do get a lot of patients that ask me this, and for a long time, there was this false paradigm that if your seizures were caused by stress, they weren't epileptic seizures, they were non-epileptic seizures. And fortunately, that paradigm has changed fairly significantly. Dr. Michael Privatera was a former president of the American Epilepsy Society, and he's an epileptologist out of the University of Cincinnati. And he collaborated with this gentleman named Shore, who had been kidnapped. And after he had been kidnapped, he had had seizures in the past, but they'd been well controlled. And then after he had been kidnapped, his seizures were under awful control. So he had medically refractory epilepsy, I believe. And so he reached out to Dr. Privatera and asked if he could start doing studies on the role that stress plays in epilepsy. And so Michael Privatera has kind of really spearheaded a lot of the research. And there was an organization called the SMILE, S-M-I-L-E Foundation, the SMILE study, and it was sponsored by the Shore Foundation. I believe that's S-H-O-R. And it showed the role that stress can play in seizures. It's not known why stress can be a seizure trigger, but there are biologic connections between the brain, behavior, and mood. So again, this is a dense slide, but this is a screenshot from the triggers of stress and stress in epilepsy, and then the tools that you can do to help reduce stress. And not coincidentally, they're the same tools in the wellness wheel to help with emotional health and other aspects of the wellness wheel. They're really all interlinked, and it's no coincidence that the things that are going to help emotional health are also going to reduce stress. And let's move on to sleep. It is so important, and it is a complaint that a lot of my patients come to me and report. Sleep disordered breathing also can lower seizure threshold. So I very frequently see a lot of adults with new onset epilepsy who have sleep apnea. So the hippocampus is your area, it's your area of memory. It's also an area of the brain that's exquisitely sensitive to oxygen deprivation. So if you're chronically every night depriving your brain of oxygen, you can create a network in your brain to where you've lowered your seizure threshold. So the hippocampus is exquisitely sensitive to oxygen deprivation, and it's also a very seizure-genic area of the brain, meaning a seizure generator. So getting sleep apnea under control can help patients with drug-resistant epilepsy. So I have a low threshold for sending patients for a sleep study who have either new onset seizures with sleep apnea risk factors, or who are having uncontrolled seizures despite numerous medications that have something in their history that suggests sleep apnea. Also, just learning how to improve insomnia and good sleep hygiene, which clearly these little guys here on the left have no problems with sleep, is certainly a way to help control seizures. So once again, here's Greg Grunberg. He was our MC in 2016, our Master of Ceremonies at the Epilepsy Foundation Colorado's Gala. He's got numerous videos on the Epilepsy Foundation website with very helpful tips and points. He has a son with epilepsy, and he shares that story. And he was a wonderful MC at our gala. But once again, there's the link to talking about sleep and its role in epilepsy. So here's the numbers of how often we really should be sleeping. And I can tell you for sure, we are not approaching the recommended numbers. We're approaching the may be appropriate. I have so many patients who probably sleep less than 5 hours a night, and it should come as no surprise that they're having uncontrolled seizures when they're having poor sleep. So it's just kind of something that happens. Okay, so this right here, good sleep hygiene, I put them together, and hang on a second, just answering something there, but still wish that I could see you guys, or you could see me rather. So this nightstand here is not the nightstand to have by your bed. The bed is for sleep and for sex. That's really it. As a neurologist, that's what I say. And it is not for getting in bed and reading and having that remote there beside it to watch TV, because what the brain does is it, starts to associate the bed with activity. And so it's like, oh, it's time to get in bed and read and be awake. It's time to get in bed and watch TV, or, and be awake. And so the brain is a tricky thing. It's almost like you have to train it like a puppy. And so that type of nightstand right there is the neurologist's nightmare nightstand. There should be no remote in your room. There should be no television and video games or iPhones and iPads, etc. All of the things that we do before bed are pretty much the worst things you could possibly do for sleep hygiene. So you can see over here the recommendations for how to get good sleep at night. And then if the sleep hygiene tips don't help, there's actually cognitive behavioral therapy for insomnia. So meeting with a behavioral health professional, getting testing to see if you're actually having seizures out of sleep. There's really a lot you can do, and it is imperative to get sleep under control, because, I remind patients all of the time. I say, what do we do when we're doing an EEG, which is the brainwave test? I have people sleep deprived before the EEG so I can bring out seizures possibly. Okay, but I tried everything to get to sleep last night. Well, everything except closing the book. Let's not get too crazy. All right, here's a particular area of interest and passion for me, which is diet and nutrition. Absolutely beautiful web page right there with some gorgeous looking salad, and looks very keto to me. But once again, there's a whole website here with a series of links. The Charlie Foundation in particular is one of the sponsors of the Epilepsy Foundation. So diet is one of the oldest forms of medical treatment. You've got ketogenic, modified Atkins, low glycemic index, and medium chain triglyceride. And this was a movie from the 1990s. Meryl Streep is a spokesperson for the Charlie Foundation. This is Charlie. And Charlie's dad is Jim Abrams, and he is a Hollywood director. And little Charlie had seizures that they could not get under control until they got him on the ketogenic diet. I won't go into the whole story, but this is Charlie graduating, I believe, and his story is just absolutely amazing. And when his dad realized that people weren't talking about the ketogenic diet, he basically made a movie so that people would start talking about it. And so it kind of came back into favor for treating patients with epilepsy. So the Charlie Foundation is a wellness partner. This is a link on the Epilepsy Foundation website. And for anyone who's interested, I totally recommend looking at Charlie's story. It kind of outlines it there. The Charlie Foundation is a great website. They've got some awesome videos on there. This is the modified Atkins diet. And again, I won't go too deep. I won't take a deep dive very much into this, but each diet is divided a little bit differently. The modified Atkins diet has been shown to be as efficacious as the ketogenic diet and easier to follow. It's not as strict as that. And then low glycemic index diet, kind of similar to modified Atkins, but again, a little less strict. But the data does support that it is as efficacious for controlling seizures, and it's actually quite a lot easier to adhere to. Trust me on that. So this is the medium chain triglyceride diet. Matthew's Friends is the British version of the Charlie Foundation. There's Matthew with his mom. Matthew has, I believe, Dravet syndrome, and his story is as compelling, and I totally recommend going to that website as well. So obesity and epilepsy can be a big problem, and so weight reduction is considered a key component in epilepsy treatment for patients with comorbid epilepsy. Also, epilepsy is a very mean disease. You're taking medications that can lead to increased risk of bone fracture, plus you have a disorder that causes you to drop to the ground and convulse and break bones. I cannot tell you how many patients I've had fracture their spine and fracture bones. On any given day, about 137 people a day are going to the emergency department for epilepsy-related injuries, and a lot of those are orthopedic injuries. So bone health is imperative for patients with epilepsy. And into bone health is physical exercise. So weight-bearing exercise does help with bone remodeling, and you know, it is very healthy for your bones to do weight-bearing exercise. So this is a screenshot from the physical activity with a wonderful video talking about the role that fitness and exercise can play in epilepsy. So this is an excellent book by John Rady talking about spark and exercise in the brain. And there is a significant amount of data showing that BDNF, brain-derived natriuretic factor, can have neuroprotective anticonvulsant benefits. And so for my patients with epilepsy, there is a fear that they're going to get out and they're going to have a seizure while exercising. And that is always a risk. And so you have to weigh the risks versus benefits. But at least even as far back as Lennox, who is of Lennox and Gastaut fame, he has a quote there that says, "Physical and mental activity seems to be an antagonist of seizures." So there are many benefits to it. Myself, I am a registered yoga teacher. So I think yoga is an excellent way to reduce stress and improve fitness. Cardiovascular fitness as well, believe it or not, can be obtained through yoga. So it is for my patients, especially right now, if we're homebound, you can actually still do yoga at home. Yoga for seizure management. This is actually a link down there to an article on the role that yoga can play. It was actually a Cochrane review. Increases flow of oxygen to the brain, muscle tissues, improves energy levels, and a sense of well-being, improves resiliency, ability to cope with stress. And the Cochrane review states, it can never really state definitive because that's just not the way studies end. The studies always end by saying more research needs to be done. And so this Cochrane review supports a possible beneficial effect in the control of seizures. And yoga was better when compared with no intervention or interventions other than yoga for seizure control. So independent living is very, very important for my patients with epilepsy. Having uncontrolled seizures and not being able to drive, especially in a rural area like Grand Junction, can be very isolating. And so independence is very important. And the Epilepsy Foundation has, again, resources here. These are all links that you can get information on employment, financial planning, health coverage. Again, I'm absolutely blown away by the resources that are available to patients through the Epilepsy Foundation. So these are some of the things to consider: seizure type, after effects, impact of seizures. Attitudes and beliefs about epilepsy. And so again, this is all within the Independent Living website with links that are available to review, and they're all very compelling. So education and employment. Again, this is a screenshot from the education and employment, and then a link down there below on how you can access that. But this is on the Wellness Institute website, and it is another link that you can click on. You know, and also the talk about it. This is Greg Grunberg's advocacy. He really does advocate for talking about it, because the more that we talk about epilepsy, the more we're going to create awareness, and the more we're going to start seeing purple ribbons in November. As many purple ribbons in November as there are pink ribbons in October. Also, here's some disability resources available to patients with epilepsy through the Epilepsy Foundation website. Social relationships. So this is a tough one right now, of course, but we're beating that. We're bucking that trend by having opportunities to meet and gather like this. Social isolation is as bad for you as smoking or obesity. So social relationships are the connections we have with other people. They are so important. We are social creatures. So it is important to have social relationships when you have any kind of disease, when you don't have a disease, but especially when you have epilepsy. So this is a screenshot from the social concerns on the Epilepsy Foundation website. And then there's also some great information on seizure emergencies. The Epilepsy Foundation just did seizure first aid, which is wonderful for family members, patient safety, those types of things. Okay, so how to improve social relationships, right? Understand your family relationships, find support networks, reach out to friends. Remember, You don't deserve to be in abusive relationships. You need people who respect you and appreciate you for who you are. And then there's more information on epilepsy and social concerns at epilepsy.com/challenges-social. And then of course the seizure first aid and safety there. I love this graphic, tardiness support group. Clearly everyone is feeling supported there, but these are again resources that are available through the slides here. So Epilepsy Connect, being a part of an engaging community. So how to use the Connect section. So this is again another way to connect socially. And here on the Western Slope, and Sydney can give us the link at the end here, we do have an epilepsy Facebook support group for the Western Slope. So I encourage those of you who are interested to sign up. We're going to have a walk to end epilepsy this June that we're all going to be very excited about. I'm hoping that it'll be an in-person event, but you know, right now that's a moving target. Back to the wellness wheel. So that was a whirlwind spin through the beautiful, colorful, illustrious wellness wheel from the Epilepsy Foundation Wellness Institute. I know I talked fast because I had a lot of information I wanted to share with you. It's a fairly dense set of slides. There's not a single thing in those slides that's not available on the Epilepsy Foundation website. It's really and truly a remarkable resource for anyone, whether it's people with epilepsy, family members who care for people with epilepsy, epileptologists and providers who take care of patients with epilepsy. And as I said, I'm going to keep putting the bug in somebody's ear to do an Epilepsy Wellness Institute wellness workbook. I think that would be really fun. So with the next steps, we invite you to join us. People living with epilepsy, the Wellness Institute has many helpful and easy to use tips and resources for maintaining a healthy lifestyle, maintaining the quality of life for you and your family. Consider the Wellness Institute as your stepping stone to improving your overall enjoyment and success. Every single day is a new day and a new opportunity for wellness. And it's a gift, and we all need to embrace that. We all need to embrace wellness. So for caregivers, the Wellness Institute provides tools and strategies to better assist you and your loved one and support you in your important role. And remember, put your own oxygen mask on first. For professionals, the Epilepsy Foundation asks that you share this information and encourage your patients to use these resources to improve their overall well-being and stay up to date on what the Wellness Institute has to offer. Subscribe to the Epilepsy Foundation's weekly newsletter. With that being said, there you have it. Thank you for your generous time, your attention, the honor and the opportunity to get to present to you tonight. Thank you to the Epilepsy Foundation. Again, thank you to our sponsors. Thank you for Greenwich for sponsoring this talk. And be safe and be well and have a wonderful Thanksgiving. Thank you. And I am available for questions at this point.
Thank you so much, Dr. Collier. That was incredible. So everyone, please feel free to type in questions. Keep adding those. I'm just going to start off with one here. For those who want to create a seizure diary, how can they start, and are there any templates they can use?
That's a great question. There's actually an app called Seizure Tracker, and it's free. And that is, it actually has, it's really wonderful when my patients bring it in. It actually even has a way that patients' family members could make a video of the seizure. I tell all of my patients that they have half of an epilepsy monitoring unit at all times. And so if you make I have had some patients that I've been able to determine just based on the video, that they do in fact have epilepsy when they weren't, they didn't have any events when they had their EEG, that type of thing. So making videos is very important. And there's an app called Seizure Tracker, and I believe it is free, but there are a number of seizure tracking apps. The Seizure Tracker is the one that I've had the most experience with. I've gone to their booth at the American Epilepsy Society conferences and had positive interactions with them. So that's the one I typically recommend to my patients.
Okay, awesome. The next question we have is, do all epileptologists share the wellness wheel with their patients?
I wish. Yeah, I'm trying to get it there. I actually, I'm trying to shift the paradigm in epilepsy and hopefully get wellness into more of the limelight. A couple of years ago, I was able to actually present on the role of integrative medicine in epilepsy at both the American Academy of Neurology's annual conference, as well as at the American Epilepsy Society's annual conference. So I have had talks at both venues on the role of integrative medicine in epilepsy. I actually teach yoga now when we get to go in person again. I didn't last year because we didn't meet in person, but it's a moving target this spring. But the American Academy of Neurology has a whole Live Well, Lead Well section where neurologists are learning about wellness. And so I feel like if neurologists and epileptologists can learn about wellness and the benefits that it has for themselves, then they can then start to realize the benefits that it can have for patients. So I am seeing a sea change just in the past. I've been out of fellowship now for 6 years, and in the past 6 years, I've definitely seen a paradigm shift. So no, I don't think there are. I think there's a lot of providers out there who aren't aware of the wellness wheel, but I'm certainly working on trying to change that.
Yeah, that's great. Do you believe that the VNS improves quality of life?
For some patients, yes, absolutely. I have definitely seen for my patients anecdotally as a clinician, I've definitely seen it improve. It's been FDA approved for depression and FDA approved for epilepsy, and I've definitely seen for patients with refractory epilepsy, I've seen it improve their quality of life and decrease. Here's what I usually see. I see a decrease in seizure frequency, a decrease in seizure severity, and an improvement in recovery time.
Okay. Another question we have is, some people have nocturnal seizures and therefore are nervous to go to sleep, but as we know, sleep deprivation can be a trigger for seizures. Do you have any advice for those individuals?
That's a very, very tough line to walk. And that's where you need to work diligently with your epileptologist to get those nocturnal seizures under control. And, there are some familial nocturnal epilepsies that, are very dangerous. And of course, people who have nocturnal seizures do have an increased risk of SUDEP, sudden unexpected death in epilepsy patients, which, has been brought to the forefront with the death of Cameron Boyce. And they have the KNO SUDEP website and the video there. So I respect the fear, particularly of going to sleep when you have uncontrolled nocturnal seizures. And that is a great question, where you are walking that very tenuous line between, being afraid that you're going to seize and possibly die in your sleep, and needing to get sleep, because if you don't get sleep, it's a vicious cycle. You're going to have worse seizures. In those situations, I absolutely recommend getting seizures under control and, working with your epileptologist to optimize seizure control. And we do have a lot of options to help, from medications to neurostimulation devices to epilepsy surgery to dietary therapy. And then at the end of the day, check in to make sure that there isn't an underlying sleep disordered breathing as a contributing factor to lowering seizure threshold.
Yeah, thank you. Well, it looks like we're at our time limit for tonight. I just want to thank AZI and Greenwich one more time for sponsoring this week and tonight. Thank you, Dr. Collier, so much for giving us this awesome presentation on wellness. So much good information. Looks like we weren't able to get to a few questions, so if anyone else has questions, please reach out to the Epilepsy Foundation, and feel free to email Wendy at caremanager at epilepsycolorado.org. And Dr. Collier, if you have anything else to add, then we'll wrap it up.
Thank you, Sydney. Yeah, again, I just can't express my gratitude enough for the opportunity to and the honor to get to present on something that I'm fairly passionate about, which is wellness and epilepsy. Certainly, the Epilepsy Foundation of Colorado is a tremendous organization. It's a community. It's a community for all of us. It's a way for us to come together. It's a rare opportunity to get to bring patients, caregivers, and providers together in one space. So thank you so much to the Epilepsy Foundation and their sponsors for making this possible. And for those of you out there with epilepsy, remember, you deserve a good quality of life. And, you know, you are the bravest people I know, truly. And thank you for the honor of letting me be your doctor. And also, as we said, please connect with the epilepsy Facebook group that is on the Western Slope. And that's all I have to say. Have a good night.